So I come to this program not only as a veterinarian, and we certainly have a lot of exposure in education and throughout the lives and working with our patients and the pharmaceutical companies and information that regards parasites, but I also did 2 externships in parasitology and received a scholarship at AH Growth Research Award while I was in vet school for my research in parasitology. And I've lived the trip of parasites in myself. So I can say that I've seen it from many different sides. And there's nobody that really can relay, as you've seen through a lot of the different programs, any topic as well than if they've lived it themselves, because we really look into what do you need to do to get rid of it. Alrighty. So it's going to be a good one here today. I will go through some information and background, grouping out parasites, going through some of their life cycle stages, and that's an area where, because it is so intricate in their life cycles, there are many different phases that can be entrapped in a body. And so it's important that you get a grasp of this, because it's going to help you understand why is it that they are so elusive. So the different tissues that you might find them in or not find them in because they're so difficult to locate, the sources of infections, factors that increase the infestation, different symptoms, how you can diagnose parasites, different products that can be used, and then what you would want to do to try to prevent infestations. All right, there are a lot of we say new emerging infections. A few weeks ago, I don't know if anybody had seen on I picked it up on the internet or something about an amoeba that had been found in some waters that had killed 3 kids. And they talk about it new. It's not new. They're the same ones that have been around for a long time. Now, they certainly can mutate and find other bodies, but it's a sequence of different events and timelines and environments. And we think about the program yesterday afternoon talking about the terrain. As the terrain changes, then these parasites, which have been there for eons, all of a sudden now become viable and can live somewhere where they never even thought to adventure before. As we see people moving, this changes also. You have individuals moving from other countries that bring those parasites, which in their bodies, because they were accustomed to a certain zone, may not have been a problem. But now they get into a new place and into your body, and now they become a problem because your body and your DNA makeup, genetic GE makeup, hasn't seen that or dealt with that in eons. One of the problems that I see in the area of nutrition is that people bring animals, they bring a dog that's, say, from South Africa into the United States, and right away they put them on a processed food, which is nothing that this breed has evolved for thousands of years. And then they wonder, why is my dog sick? Well, if they fed it what it was raised on, where it came from, you wouldn't all of a sudden see all these other problems. And so as we travel and we go to other countries, you have a better chance of picking up something. If you travel out of your zone a lot, you need to be more aware of parasitism and the potential for picking it up. So again, with the people traveling, their animals travel, and they're going to bring new infectious organisms into other areas as well. Transportation of plants and food. So I really believe that the largest area of our infestation really comes from food sources. So when you travel and you're eating and plants and vegetables that come from the ground, if they're not really washed well, you have things that fly around and land on them. That's one of the big infection sources. A way that viruses are transmitted is that flies crawl around on the vomit and feces, and then they go fly someplace else, and then they land on some food, and then you can consume that food. So we have to think about really cleaning and washing, and if not, doing the parasite cleanses periodically and getting yourselves tested. So they're not just third world countries anymore. And while you may, in third world countries, see the more dramatic, the parasites coming out of the skin and the cutaneous larval migrans where you have it under the skin, or the migration into the eyes, and you see those kinds of things, but they're everywhere. So those of you who participated in my little survey that I did, I want to thank you for holding that vial of parasite protein and allowing me to run the biotensor. I came up with 65% at this conference came up positive for parasites, which is probably low to the general public. I think you would probably find 90% or more of the general public would really be positive to parasites, and this group is just more aware. So just because you've treated yourself once doesn't mean you're in the clear, believe me. So parasites can be a small single-celled organism like coccidia, an oocyst, a protozoan organism, or they can be multicellular worms. They may be visible or invisible. Very intricate and complex life cycles, yet they thrive. This is one that just blew my mind when I learned about this one, of course, a long time ago for me. But did you know that a heartworm larva has to live in a mosquito for 3 weeks before it is infectious to another being? So the mosquito bites the dog that has the microfilaria in their system, and the heartworms produce a baby worm. So this baby worm is called a microfilaria. So they produce this microfilaria which circulates in the blood. So the mosquito picks up that microfilaria. Now that microfilaria has to go through 4 different transitions to a 4th larval phase before it's infectious then in another being. So it has to live in that mosquito. Now, how long does a mosquito live when it gets on you? Not very long. That's right. But if you think about it, that's pretty intricate, that it has to live that long, go through those many stages before it's infectious. Then it gets into the other body. If it's a dog, then it's going to go through from that 4th to another 5th larval transition before it then makes its way to the heart and starts growing into a heartworm, which can live there for years and years and years and years, and they multiply in the body, and it just becomes a swarm of all of these worms that enlarge the heart. But it takes that much time. Now, that intermediate phase of that heartworm could get into a person. You could have a larva stage of a heartworm in your system. It won't become an adult heartworm in you. That would be really, really like off the wall. But you could have a parasite that's circulating around in your tissue that's causing you problems. And you're not going to find that. They don't come out in the feces. So very complex life cycles. Parasites quickly adapt to environmental changes, also to drugs. We're constantly having to come up with new generations of products because the parasites become resistant to them, and then they prevail. So constantly changing and rotating. In the veterinary industry, we rotate compounds. You don't use the same ones in order to avoid that from happening. Many of the parasites never enter the gut. That's what people tend to think about. If you think about parasites, you think about worms, and you think about ooey, and then you think about, well, if I take this medicine, I'm gonna find them on my bed sheets, and mostly no. Most of the time you don't, because there are more other parasites than intestinal parasites. And then the other thing about parasites is that they do carry bacteria with them, and then bacteria contain viruses. And so because of that parasite, you can come down with a plethora of other problems. And the other problem may appear to be the most serious at the present time. So you could have fever because of a virus, but if the underlying problem is really the parasite, and you don't get rid of that, then you're still not going to find health. And I say you speaking to people, but it's the same. It doesn't matter whose body has the parasite. So these are the basic categories of internal parasites. So I really wasn't going to talk about lice or mites or things like that. I'm just talking about internal parasites. So you had trematodes, which would be like flukes. Cestodes are like tapeworms. We have nematodes, which would be like roundworms, hookworms, astrongyles, the whipworms, all those kinds. And then protozoan organisms. So that's going to be like coccidia, amoebas, giardia, the smaller. Righty. So these are some of the different cycles of stages. So we have eggs in some of the parasites. Those are going to be like the trematodes and the nematodes. Oocysts are what a protozoan organism produces. So they don't produce eggs, they produce the oocysts. We have to get all our terminology right, you know. Then there's larva, and there could be one larva stage or multiple larval stages, as I just told you about In the heartworm, it goes through the 5th stage, is actually an immature adult stage. Then you have the adult, and then as in some parasites, like the heartworm, they produce what are called microfilaria. They don't produce eggs or oocysts, they produce these little baby worms, and that's what they're called, microfilaria. And they just circulate in the blood system. So there are different stagings of these parasites in their hosts. So we have a definitive host, which is one that is necessary in that life cycle. We have an intermediate host, which would be one that is in some phase but not a definitive host as far as the end stage. The end stage is the very last phase of where they want to be. And then you have the accidental host. So those accidental hosts need to have accidental cures come along. Because they're the ones where you would least likely find it. You say, well, it's not supposed to be there. It's accidental. So like a person having heartworm microfilaria would be an accidental host. It's not supposed to be there. So we have a condition in horses called EPM, equine protozoal myelitis. This particular parasite has to go through a bird and another creature. Now, opossums seem to be one of them, but there could be others before it gets to the horse. And this particular parasite migrates through muscle tissue, but it also gets into the nervous system. So now, the nervous system disorder does not appear in the opossum or the bird. So they're definitive intermediate hosts for this life cycle, but they're not the end stage. The end stage is actually the horse that develops the condition of this entity. Not to say that you can't, as an accidental host, have problems, but you don't have the symptom condition of that end-stage host. You can have a plethora of others. So you can see how, again, it becomes oftentimes difficult to figure out, okay, exactly what is this that's causing a problem? Because there's so many different phases and stages in parasite life cycles. Another one, for example, would be tapeworms. So your dog or cat gets tapeworms because of either eating a rabbit or a flea. It's the only way they get tapeworms is a rabbit or a flea. So then once they eat the rabbit or the flea that contains not the egg, but the larva stage, then it opens up in their stomach, and then this tapeworm, I have a picture of one in here a little bit later, produces what's called a proglottid, which is a head that attaches. It has the head, and then the head makes the proglottids. And these little proglottids are the things that you see then that would be on the tail or on the feces, and they move. But they're just a nerve packet of eggs. They have no mouth, no digestive tract, but they move, which makes you think they're real. But these little segments, the proglottids that fall off, then get into the ground and desiccate, and then the flea or the rabbit picks those up, and then that's how it gets transferred. In people, you can develop an intermediate phase of this called hydatid cysts. So some of these different types, and there's a bunch of different types of tapeworms, once it's in your system accidentally, it actually gets to the liver, and then it creates this big fluid packet of these other intermediate stage tapeworms. And I remember in one of our parasitology books, it was a picture of a person from another country, a third world country, and this guy, when he was like Africa, he had like a wheelbarrow, and his abdomen had gotten so big from this hydatid cyst that when he walked, he had his abdomen on this wheelbarrow so he could push it around. It had gotten that large. So some pretty bizarre things can happen from parasites. But then you may never see them, and they can still be there. Alrighty, so their life cycles are very intricate. Look at the list of organs used in the life cycle. There's hardly any place that is not in some parasite. Now, that doesn't mean every parasite uses all of these organs or glands or tissues, but they can, different ones. There's even parasites that reside in the lungs that you could find in the bladder because of their life cycle. So you have to be aware that anything is possible when you're talking about parasites. Then you also have the tissue that a parasite might use in a larval phase in its migration. So cutaneous larval migrans, which is a phase of a hookworm that gets in under the skin. We don't see that in the dogs or the cats, but it can happen in a person because it's lost. And so you can have like this flare, a circular or linear pattern that might look like some kind of a rash, but it's actually the trail of this larva going under the skin, cutaneous larval migrans. And so you have some that get in the eyes. They can certainly be in the mouth. Brain is another area. I had a classmate of mine in vet school that did an externship in Hawaii. And she was there like for 3 or 4 months. She did 2 rotations back to back. And all of a sudden, while she was there, she'd been there about 6 or 7 weeks, she started having seizures. She'd never had seizures in her life. She ended up in a hospital. It took them several weeks to actually determine that she'd picked up a parasite. And it was this parasite that had migrated to her brain that caused the seizures. And it took her, I mean, she was on many antiparasitics and had seizures for about 4 or 5 years and doesn't anymore. But it took her that long, and it only took her no time to catch it while she was there. Then it went through its phases and got to her brain, but how long it took her to get over it. Spinal cord, certainly like EPM does, and there's others that can migrate through spinal tissue too, and then reproductive organs as well. So this is actually a worm cell packet of, this is Diploidium caninum. So inside that little packet, that's what comes out in that proglotta, that little bit of that tapeworm I was telling you about. And then each one of those in there is actually an egg. So in a fecal sample, you might get that whole packet, or you might just have those little eggs individually. That's what they look. So what are our sources? I really believe that number one is really uncooked foods, salads, fruits, vegetables. I mean, that's what we want to eat, but what we really need to make sure that they're cleaned well, and especially if you're traveling somewhere else. And we get things shipped in. You don't want to assume that anything's been washed. And it just, somebody asked me the other day, I was cutting a cantaloupe, and the person said, "Did you wash that cantaloupe?" And I'm, no. Well, because you clean the inside, you're thinking, well, that's clean. Well, what about if the outside has something and then it contaminates to the inside while you're cutting it up? Anything's possible, and they're microscopic. And I always wonder, where do them fruit flies come from? Your house doesn't have them, and if you cut up something and you kind of like leave the peelings there, I don't have a garbage disposal, so we take it out to the compost. Well, you might come in the house in the afternoon and hear some of them little natty things flying around. Where'd they come from? They had to hatch out. They had to be on that somewhere, and it took them no time. Just think about your water source. Drinking water, depending on where you are, and again, if you're traveling outside the country, but also swimming. I cannot think of any single time when I was trying to learn to water ski, or when I was jumping off some cliff into the water, that I didn't get a slurry of it up my nose, down your throat. You hang out in it. You know, of course, you can get things through your skin, too. But you're ingesting that, and it could have all kinds of little buggers in there. It's possible. All righty. Now, I put all these little animals on here. Aren't they cute? And the donkey's not going to talk about it. He's got his butt to you. But really, we can pick up things from livestock and from animals, from their feces. Now, the thing is, it's not going to be fresh feces. You're not going to get parasites from petting your animal. You're not going to get it from your cat's litter box if you clean the litter box every day. You're not going to get it from the yard if you pick up the dogs when they defecate at that point in time. Majority of them take several days for them to ovulate, to develop into the larva. It's not the egg that's infectious. It's the larval stages. So if you have a cleaner environment, it's not going to be such a problem. Most parasites prevail in dirty environments. Coccidia, which is a protozoan organism, is very common in like puppy mills and places where you have lots of dogs that are there all the time, and the people don't really clean it, and they get into cracks and crevices. They're common in rabbits too. And a lot of these can infect people as well. So maintaining a clean environment for those people is really important, and washing your hands. And people go barefoot. There's lots of people that go barefoot everywhere. I mean, that's a big way that animals pick up parasites, is because they're barefoot all the time. And so you have to be careful about that. If you're gardening, and we like using the manure in our compost, and you know, we get it out of the bottom of the horse pile, but it's been there longer, so you have a better chance that there could be something there. Again, insects like mosquitoes biting you can transmit things. The zoonotic diseases are those that you would contract then from an animal. And parasites, you have to remember, opportunists. Really, if your frequency is where it should be. If you are living in the frequency band and your organs are good and your autonomic nervous system is good and you're vibrating at the right frequency, those parasites can't live there. I look at the band as going vertical, but the other day the chart was up there where it was going horizontal. And there's the frequency band where people live, and then a little bit to the right was bacteria, and a little bit to the right of that was parasites. So if your harmonic resonance is where it should be, you vibrate at a frequency that drives them batty. They don't want to be there. They can't exist. They can't live in that frequency band. So as you drop, is the way I look at it, or move to the right, because your autonomic nervous system is weak, all those things that compile that, other diseases, conditions, poor nutrition, you get into that frequency range, they can find a niche. They go, okay, now I might have to do a little bit of a different dance, but I can find a place to replicate. I can find a place to hang out. So we always got to be looking about bringing ourselves into that harmonic resonance of where we're supposed to be, and then you won't pick them up, which is why in any environment, one person can be sick and 5 other people don't ever get sick. Somebody may get, even in a barn of horses, talking about the EPM, you may have 1 or 2 that contract this from the same food. They believe the food is where all this happens in the processing. And the rest of the barn doesn't. What's different about those horses? They're certainly over-vaccinating all of them, because they do that like twice a year to horses. They're eating the same food. What was different? Their harmonic resonance was in that other band where the parasites couldn't become the opportunist. Dental problems. Horses are the least likely. They get a lot of dental care, but dogs and other animals have a lot of that too. All right, so we're moving into what increases the prevalence of parasites. This, the one on the left, this is actually that. There you go. This is a tapeworm, and that's the scolex, the head, and that's the little sucker that attaches, and then it just keeps getting longer. They can be, they can be feet long, and they just keep making the little proglottids. So anything that suppresses the immune system or lowers the autonomic nervous system is going to increase the likelihood of the parasite. So nutritional deficiencies, food allergies. I do a bioresonance test, what we call the 5E. That's viruses, bacteria, heavy metals, chemicals, and parasites. If there's any of those in the tissue, that's going to interfere with the resonance of that body, which is going to make them more susceptible to other things. Any kind of toxin in the system. Altered body frequency, so that weak autonomic nervous system, stress, even like we know all of our stresses, but from an animal's perspective, for some, a dog, when the person leaves home, when you get your suitcase out, they already know you're going to be gone. They start stressing. And they'll show it as diarrhea if you happen to take them to the kennel. So they have to prepare for that. But other ones, you leave and then they tear up the door. You come home and your baseboard's gone. For horses, they can be stressed. They go on the road a lot. They're going to shows a lot. You have ones that are stall walkers, wall bangers, cribbers. They chew on stuff. Stress. Mental stress is going to reduce your body's ability to adapt to anything and everything. Liver malfunction is huge. The liver is such an important organ. And most of us, because of all of those other things, animals included, have liver malfunction to some degree. And if you're not addressing the liver, you're missing a big part of the picture that's so crucial to being able to get that body into a healthier state. Other factors, stomach pH is really important. If the pH environment of the stomach, if you have the saliva and you have the enzymes and all of this is working right, then you have a better chance that everything past that point is not going to be able to exist. So even if you picked up the parasite, if your pH of your stomach is right, then it's going to be ruined at that stage. And then there are certainly dyes in foods, different things that can, again, allow the parasite eggs to survive in the body, whereas otherwise the body would eliminate them. I also test for the animals. I show the people how all these other things affect them. So I look at dyes, I look at preservatives, I look at antioxidants, and I also look at what are called emulsifiers that are in the food that turn it into a slurry so every part is equally the same as the other part. And I'm sure they use emulsifiers in some of those like fake potato chips and all that kind of stuff that they make too for people. But there isn't any animal that I test that is okay with dyes. They're just not. So the dog's food doesn't have to look like that little round piece is a green pea. They don't have to put green dye in it. That doesn't matter to the dogs. You know, that's a whole human thing, trying to make it look like people food. Yes?
What is lanthanide dye?
Lanthanides metals. Dr. Yu, I'll let you tell me that one because I got that out of your book.
Just a heavy metal that has like a hot cloth that you might actually using cancer. Like array of heavy metals, yeah.
Just part of the periodic table.
Array of heavy metal? Okay. Okay, so by virtue of the definition of the word parasite, they're going to live off the life it inhabits. Anything that they're doing in your body is going to be destructive to your body. So they're going to create nutritional loss, cellular damage. The toxins that they produce actually aggravate the immune system. So see, that's how they live. If they didn't get at you some way, shape, or form, you'd get rid of them. So they have the toxins that they keep releasing that aggravate your immune system that just improves their ability to thrive. And they're in there saying, hallelujah. You know, that's how they persist. Okay, they can even elicit autoimmune diseases. So the presence of those, and then the body gets confused, and now the body starts attacking itself because the parasite antigen is there in the tissue, and it sees that antigen is foreign. Well, with that antigen now is the identity of that particular organ, so now the body starts attacking itself at that organ. All started because the parasite was there. The body is trying to get rid of it and change it, but in so doing, things can get so messed up that you have more disease than just the parasite alone. So parasite-related phenomena are all these other situations that go along with that invasion. So the 5 elements then that I look at that interfere with the heavy metals, so in the environment, in foods, even certain mineral deficiencies. If you do hair analysis, and I do this with animals all the time, do a fur analysis, there are certain mineral deficiencies or mineral excess. Like if your body is really high in sodium, it will pull in aluminum. It just does. And if the body needs certain minerals and it can't find them, if the toxic metals are out there, free game, it's going to plug that toxic metal in the place of the mineral that it's not provided in the food or the nutrients that it's taking in. Because it has to try to make this system work. It has to try to make all these organs align. And this is why doing hair analysis is so much more valuable in a blood test for just a general profile, because the blood is that moment of that day, of that point in time. Whereas the hair analysis has given you a reflection of at least the past 90 days, but that 90 days is an accumulation of the 90 before that and the 90 before that. So you can find out everything about the autonomic nervous system, about the adrenals and the thyroid, what you should eat and what you shouldn't eat, and what's happening in the body by doing the hair analysis. So there's certainly chemicals everywhere. Viruses, this is really interesting, is the fact that when I test an animal and the virus comes up, and the virus can get in with the parasites, people, oh, where'd they get that? Maybe they were vaccinated and they got it that way. But you can also have a virus that was in the past, just like with herpes virus. You have the chicken pox as a kid. Well, it's not gone. You can either get the fever blisters or you may have shingles, depending on what happens to your resonance and where you fall. And if your immune system is low enough and you're stressed enough, the shingles can pop up. It's the same virus. Well, that can certainly happen in the animals. Not that we see necessarily the fever blisters and that, but there are all kinds of things that can come about. So a lot of these animals have any of these. And then what I look at is finding what's the primary problem. Is it parasites or the viruses, whatever comes up positive, which one's the primary one? Because if you treat the primary one, the other ones are going to disappear. So if the virus is there because the parasite's the primary, we treat the parasites. When the animal comes back, there's no virus to treat because it's gone now too. The other thing too, that because parasites are seasonal, like this time of year, there's babies in the summer. Baby chicks are born, baby rabbits are born, there's more kittens and puppies born. Summer is birthing time. Same way with the parasites. So you're going to find a heavier parasite load in individuals and a more likelihood that somebody's going to pick them up at the end of the summer because of what they did in the summer. People were out gardening, there's more, everything is being born in the summer, and so you got a better chance then of seeing them. So normally when I test the dogs, maybe I'd find 30 or 40% of them with parasites. In the past couple of weeks, I'm up to 90% of the dogs coming in are positive for parasites. And we think about our animals, they're treated with antiparasitics a whole lot more. I mean, they're treated all the time, but there's still other ones out there. So a list of different things that can happen. So we don't want to just think that you're going to have diarrhea, or you would see the parasite in the stool, or you're going to have a bellyache because you have parasites. There's all kinds of other things that can come about because of parasites. And some of this you've seen before. Dr. Yu's list on our first day on Friday, and had this there too, but I put poor coat on there. Yes, poor coat. But did anybody ever think about the fact that maybe their hair's not as good as it used to be, and maybe it's because there's a parasite? We don't think about that. We go, your coat doesn't look so shiny today. But it is true. If you have any kind of malabsorption, then it's going to be reflected in all parts of the body. And one of the areas that the body will see as the least important to survival is your hair. It needs other protection. It needs so much nutrient for the heart. It needs this much nutrient for the muscle. But the hair, it can do without it. So you're going to see changes in general health in the hair and coat very early on. And skin too. Alrighty, so all kinds of things there that can be a part of parasites. So you don't want to just think that it's the standard. Sweating at night. So a lot of people, especially women, think, oh, it's the hormones. Not necessarily so. You can sweat at night because of the parasites. The parasites migrate at night. That's when you're kind of like, your sentry, you've only got one guard on duty, you know, the guys on the watchtower, but the rest of the officers and the military is all asleep. You got your few walking the perimeter. Parasites know that. So that's when they're out doing their thing. They're migrating more while you're sleeping. So your body will recognize this. It's going radar, 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 radar. Well, what's it going to do? The heart starts beating faster. Your thyroid's going to try to work to get the generator going. It's going to try to create an environment that is less inhabitable for that parasitic phase. So your heart can get faster, your body gets warmer, so you can get hot while you're sleeping because it turned up the engine. The furnace just went on. And so you don't always want to think that it's just this, because it could be from parasites. And then somebody who wakes up in the morning and maybe complains when they first get up of their hands or feet being sore, that can be because your furnace was so hot that your joints picked up inflammation. And so this is how I know I have parasites, is when I wake up in the morning and my hands are stiff and sore in my feet. And every time that's happened and I've gotten checked, and I go to a nutritionist that does the the CRA, and then you use biofrequencies. You have to have some kind of a resonance. Something has to tell you whether or not that's really there. And now that I know when I have the parasites, every time that happens, I go check. Oh yeah, there it is. You got them again, of one form or another, whatever it is. And you really only know what it is based on what kind of medication or supplement or homeopath you end up needing, and then you can kind of categorize what it is. But you don't have to know, you just have to know that they're there, and then you go after them. So let's see here. So other lesions and scars can show up in the body because of the parasites, because of where they travel. They can leave scars in your lung tissue, scars in your liver, and scars are a setup for pain. Scars create pain in the body. Any scar is a block to electropheresis in your tissue, and it can cause pain somewhere else. So you have to be aware of that. The other thing that's really important in this new age, which kind of seems to be a digression to me, is all the tattoos. The body sees tattoos as scars. Scars and tattoos are the same in that body's recognition. So you have to realize that these are also going to be be blocks. They're going to be therapy blocks. They're going to be energy blocks. And so the scars have to be treated. And so you need some kind of a system to eliminate that. And the area that I've worked in for over 10 years now is the alpha stem microcurrent therapy. You actually, with that waveform, can take a scar, and what it does then is to put little micro holes through it. It gets through that, it permeates it, and creates like a Swiss cheese effect of that scar. So instead of having this very dense board, you now have something a little bit more like elastic, and so electricity can get through it. So you have to have some way of treating these. A couple years ago, I was in California at a hospice conference. They do hospice for animals owners now. So it's a big new thing, hospice, yes. And so, yeah, a weekend of weeping, if you can imagine that. Then you had to go put your alpha stim on to get your energy level up after all this sadness and everything. I thought, I'm not going to do that one again. But at any rate, there was a woman there that I was doing a demo with. She had all these different problems, and she came with one problem she was talking about, but you couldn't help but notice that she had tattoos all over her body. And so I said, okay, after I visited with her a little bit, I said, I'm not being judgmental about you, but I just want to share with you something that I know to be true, is that those tattoos are like scars, and they're going to create pain, and this was part of her problem. And I said, and they will block your body. I said, especially anything that goes all the way around. If a tattoo closes a circumference, that is bad. And she says, oh, well, that explains why ever since I finished the tattoo on my her left leg, animals have rear legs, people only have left legs. So. Right rear, left rear, okay. Her left leg, she had edema. As soon as she finished the last of that tattoo on her left leg swelled, and she could not get rid of this edema in her left leg because she had just cut off her circulation. So around your wrist, what's that going to do? Anything that encloses, the worst is going to be a tattoo that goes all the way around somebody's neck. Can you imagine that? They have just cut off their circulation from their head to the rest of their body. So you need to be able to treat the tattoos, yes?
How do you treat with an alpha stem for a scar?
You use the probes, and it's the standard treatment, of course that would depend on what it is 3 minutes a day for 4 days, and then in a month you do it again 3 minutes a day for 4 days. You hold a probe at either end. Yes. And if you have a scar that turns, you got to treat here, and you got to treat here.
And is there a certain frequency that you need to use?
Well, anytime you're using the probes, you want to use the 6 setting, the 600 microamps, the highest.
Okay.
Yeah, unless it's not comfortable. And if it's on the face, there's no way you'd be able to go that high. Maybe a 3. Okay, good. So you want to be aware of all those things. Oh, there's our really pretty tapeworm. Isn't that beautiful? How can something so nasty be so pretty? The CDC lists 110 different parasitic diseases that would be communicable to people. So that's a big slew of them. So there's all kinds of different options we have out there. Difficulty in diagnosing. Only a small amount are actually in the intestinal tract, and most tests are run on fecals, and so you may not find them there. Also, the parasites don't necessarily produce eggs all the time. So if you're looking for an egg and it happens to be a parasite that's on a cycle, they could still be here, but you won't find them there. And there are many that are that way. If it's an intermediate host versus an end-stage host. So you're not going to find eggs being produced in an intermediate host of a certain cycle of a parasite because the adult's never going to be there anyway. So you're not going to find them in a stool sample. So we have minimal reliability there. You can certainly have false negatives because of the things I said, irregular release of eggs. A small count may not be detected. You have to be really good at looking, and it's on microscopes. There are some other tests that are coming up, and for many of the parasites, there's actually no test at all. Also, multiple life stages. So I talked about that a little bit already. The resistant. A lot of these parasites actually have an exoskeleton. And so that's going to make it more difficult in diagnosing and also in treating because they're more impervious to things. So if they have an exoskeleton, they may even be more difficult to get rid of. The fact that they migrate at night. So if you're looking at a sample of something from the middle of the day, you may not find it. Whereas if you took a sample like first thing in the morning, you might be more likely to find a parasite. And then the cyclic phases. The oceans move by the sun and the moon, and so does everybody else. Parasites, the pineal gland, You know, the north and south, the magnets that direct the birds where to fly, all these things are affected by all of that. And the parasites are the same. So we have to realize that there's certain phases of the moon that's going to optimize their survivability. And so if you're treating and you're looking for them, those are the times that you want to clue in on. All right, so there's fecal flotations, fecal smears, urine analysis for parasites that go through like the kidney. Also in a fecal, you might find a lungworm because what happens is they cough it up, they swallow it, and then it comes out in the feces. So you might find a parasite egg that went to some other organ in a fecal. There are the ELISA tests, which are actually antigen-antibody reactions that are done, which are a little bit more specific. So they do that kind like for a heartworm test, looking for the antibody of the heartworm and the antigen reaction. And there's also a new one now for Giardia. So I got that on here in the next slide. Biopsies, if for tissue, looking for it there. Bioresonance. So this is another way to determine for those parasites that you're not going to find in a sample, some kind of an energy source. So whether you're doing, you know, like the tensor that I use, or any kind of muscle testing, kinesiology, or the systems that you've learned about at the conference here, all of those are going to use a resonance to determine, okay, is this frequency tissue present? And that's going to be a huge avenue to being able to really determine the presence of parasites. So this is what the new Giardia test looks like, and it's kind of like those little pregnancy tests where you put the sample in the dot and then those little lines are going to change colors, and it can be done within 10 minutes. And the tests are good for up to 12 months. So another way to detect those. It's actually a sandwich system, a colloidal gold, and also a similar antigen-antibody type of a reaction that they're looking for. And then they migrate, and so you get the different changes in the bars. All right. So there are a lot of different antiparasitics. We have the group of herbals, and not every herbal parasite combination is going to work for every parasite. Not every protozoan would respond to this. Not every nematode would respond to this. So there are many that you're going to have the chemical drugs available for. But this is a list of different options of ones that you would find in herbal remedies and that would work. And so you kind of get what works for you and what you feel comfortable with and have consistently good results. All right, chemical compounds. So there's many of those. Pyrantyl pamoate, ivermectin, praziquantel, that's one for tapeworms. And then we get into combinations. So an ivermectin praziquantel combination, fenbendazole, oxybendazole, levamisole. So a lot of different generations. So like oxybendazole is an up generation from fenbendazole, which was an earlier one. So we continue to make new options because the parasites continue to mutate. And so you always have to be aware of those changes that are available too. So I have like a test kit of whatever, 20-something different antiparasitics, and then I will test those against the body, just like you would use with your devices, and then find out, okay, which one or two does this body need for this particular parasite that we're going to treat. And so I can kind of tell, like if they're wanting ivermectin or pyrantyl pamoate, it's probably a nematode. So you've got roundworms, hookworms, something like that. If they get into using the sulfas, like if it's metronidazole, then that's probably like Giardia or Coccidia or a protozoan type organism. And if it's the sulfa, that works for Coccidia as well. So you kind of start seeing when somebody says, well, what do I have? Or what does my dog have or my horse have? And I said, well, let me see. I'll tell you when we get to the end. So you can kind of categorize them by those four groups, the cestodes, the nematodes, the trematodes, and the cestodes, nematodes, what was my other one? Protozoan, thank you. Depending on which of the product they want. And then you can find out, okay, how many milligrams per pound, how many days in a row, when do I repeat this cycle? And this becomes really important. Hearts did a great thing. Hearts had that once-a-month wormer. Remember the commercials, the Hearts once-a-month wormer? You know why you had to do it once a month every month? It was treating roundworms and hookworms. Roundworms recycle in 2 weeks. Hookworms recycle in 3 weeks. So if you're not doing it a 2-week cycle or a 3-week cycle, and you're only doing it every 4 months, or maybe every 4 weeks, once a month, they're going to continually be ahead of you. What a concept. Don't give them all the truth, and they'll constantly buy your product. So you have to understand the life cycles. Whipworms recycle in 90 days. And whipworms are one of those that don't always produce eggs, that are very insidious, difficult to find. They're tricksters. But they cause a lot of tummy problems, a lot of like gas and bellyache and that kind of thing. And so you have to treat the whipworms, but then you have to treat them again in 90 days. Well, if you don't hit that 90-day time, or if you forget to do your 90-day retreat cycle, guess what? You get to do it 2 more times at 90-day intervals, because that's how they cycle. That is their life cycle. So aren't parasites just amazing? All the stuff that you got to know about them to get ahead of them. All righty. Then some other homeopaths. There's a company called Sir Royal, and I bumped into this one because of another veterinarian that uses their product for these animals that have hypervaccinosis, where they've been over-vaccinated, and this company has a product that helps with that. So I use them for that, and then I started looking into their products. So these are 2 of their, and if you're a true homeopath and you want just one thing, this isn't going to be it, because it's a combination of the different concoctions that are in these. But those are 2 that I do use, and 17 seems to come up as a compatible more times than a 39 does. And when I have that for a dog or a cat, and that's what they're wanting, or a horse, I know it's something bizarre. It's not one of the typical worms that we're used to seeing when that's the one that they're picking. And then Dr. Yu had mentioned this Hellman, and I don't know where you get that one from. Where's that company?
Picana.
Picana?
Yeah.
Is the company for the Hellman. He had that in his program the other day, so I put it up there so we would have that as another homeopathic option. And then nutritional supplements. So Standard Process has a product called Zymex 2, and there's probably others that are similar. And this is something that you want to use for those that have that exoskeleton. You have to get through that. So what this does then is to digest. It gets at their protein. It eats up that skeleton. So then the drugs can actually, or whatever product you're using, can actually kill the parasite. So that their armor, you have to get through their armor to really get rid of them. So that's one of the things that you use. So I know that if I'm going through this and this Zymex 2 is coming up as something they need, that this creature that we're going to go after actually has an exoskeleton. And that's how we're going to get finally rid of them, is by doing that. So there's some options on what you can do. So what else can be done to help prevent infestation is, number 1, improving the autonomic nervous system. If the autonomic nervous system is not communicating, if your biofrequency level is not vibrating like it should, then anything negative is possible. So we want to look at the sympathetic dominant system. You want to reduce that. Now there are certainly creatures that are sympathetic dominant. A rabbit, a deer, they live in sympathetic dominant. Herbivores tend to be horses. It's like they're always looking for the hole that's going to suck them in. And the mountain lion, the cougar that's going to jump down on top of them. They live in this fight or flight mode, and that's typical of herbivores, but they're comfortable there. They're a prey animal. Everybody's after them, and that's how they survive, is always on the lookout. But if you had to live, and I guess many of us do at certain times, like a rabbit or a deer or a horse, it's not comfortable if you think about that. Always worried and wondered what's going to happen. So you've always got that fight or flight turned on, and when you have that, you tend to be nervous, anxiety, type A, but also as you're doing that, your parasympathetic is shut down. If your parasympathetic is shut down, you don't have saliva, your pH of your stomach's not going to be right, your digestive system is not going to work right, your gut isn't going to be correct, and the gut is a huge immune system factor. You have to approach what's going on in the intestinal tract and the lymphatic system associated with the gut in order to really ever get health, that with your liver. So we want to do those things that's going to improve the immune system and working through to get this autonomic nervous. So we got to have a parasympathetic system working. Otherwise, you're just at the advantage of the parasites and the viruses and everything else. So body biofrequency, talked about that. You want to get your energy level up. I talked about the tone scale, where you're at. If you're dropping down the tone scale. So think about how you feel when you're laughing is a higher tone. When you're happy, you're higher tone. Think about the times that you got this friend that called you and you met and went out to dinner and went to lunch and you laughed and you just had this great time and you come in, you're thinking, why don't I spend more time with her? And then you have this other person that calls you on the phone and they want to get together and you're a little bit hesitant, but you do it anyway. And you go and they natter and they suck all your energy out of you and the food doesn't even taste so good. And then when you get home, you're thinking, dang it, I knew I shouldn't have done that. I feel worse now than I did when I left. Why did I do that? So emotions are that way. Grief, apathy, those are lower emotions, and those are going to pull you down. So you got to be able to do things to get you higher on that tone scale, because that's where you're going to thrive, not where the parasites and the viruses and all the other buggers thrive. So reducing stress, I'm still working on that one. You know, I think too, and especially like a group like this where we're out there on the edge, where we're these overachievers, where we're pushing the buttons, where you always know you're on the radar, where you're, you know, I've lived on the edge. And you learn how to duck for that bullet, that arrow that's coming at you, but it doesn't make you stop because you know you're right. And if you give up, you cut your inner self, your integrity. And when you die, all you take with you is your integrity. So we can't stop, but we've still got to figure out how to reduce the stress and how to keep our autonomic nervous system working. The alpha stem is the way that I've learned to do a lot of this. The alpha stem supports the parasympathetic system. It's been on the market for over 32 years. It's FDA cleared for anxiety, insomnia, depression, and pain. It supports via the vagus nerve. It is the key to helping to balance in the brain what's going on in the body. And there's a whole lot to this, and I actually do lectures on alpha stem for 2 days. I have a program next week. Yes. Now, the kitty cat, his eyes were already like that. He's a Manx that had every problem. The alpha stem didn't make his eyes look goofy, but those are, yeah, they don't mind it. They like it. And animals are very in tune to their body. You know, they want to get well. You don't have to worry about them faking you out. When it works, you know it. And so, yeah, they do very, very well. And of course, then you have the client and the animal that they can tag team, and they can both use the alpha stem at the same time. So 20-minute treatments 2 times a day. For the animals that have really, really bad separation anxiety, it's longer than that. We might even start at an hour twice a day. But the clients do it for their animals. I mean, they will spend time and money on their animals. They may not take their supplements, but I guarantee you the animal's going to get theirs. So sometimes I kind of like back into helping people because I'm helping their animals. And a veterinarian who believes that they go into the veterinary profession because they don't like people and they want to just treat animals, they missed the point. Because every time we're treating an animal, we're treating that person as well. It's all about that. And there are many times that I'm going working up the patient. My practice is not a traditional veterinary practice. I do chiropractic, I have a nutritional practice, pain management, I do physical rehab. So everything I do is not like anybody else. And I worked with laser in like 1997, 98, 99, developed some laser pads for a company that could be used on animals and people. And in 2002, I was invited to do a program at the vet school on what I do in my practice to the holistic club. And so I took the laser and did all this. And after that, I was actually ostracized from the vet school because the stuff that I was doing was like too far beyond what they could perceive. Now, laser is in every single magazine, journal, article, convention that I go to. But I was too far ahead of the game for them, and their minds just couldn't believe that something like laser could change cells and reduce inflammation and create any kind of wellness. And for them, it was, well, you want to use the word quackery. But, you know, sometimes. But it didn't stop me from doing what I did. But, yeah, when you're out there ahead of the game, those kinds of things are going to happen. Alrighty, so my closing comments. Parasites can live in a body and go undetected for years. You will find what you seek. They're only undetected because you didn't look for them. You didn't use some method that allowed you to find them. If you look, you will find it. And if it doesn't make sense and won't go away, then go ahead and treat for parasites. That's been a tradition in veterinarians for a long time. It's like if you can't figure out what's wrong, then just give them another wormer. And I'm sure that became somewhat of a plausible method of approach because it probably did, in many situations, correct the problem. Maybe you didn't find them in the fecal sample, but they were somewhere else, and it actually did eliminate the problem. So they're out there. Look for them, and you'll find them, and your patients will be better. And I suspect 65% of you will, too. Yes?
One of the internet lures for treating parasites is diatomaceous earth, and I didn't know if you knew about that. And the other one that a lot of people talk about is high doses of salt. Have you?
Well, okay, so the question is diatomaceous earth and high doses of salt is used as some kind of an antiparasitic. I definitely wouldn't go with the high doses of salt, and I've not heard of that one or anybody come to me, but I definitely would not do that. Sodium, potassium chloride, I wouldn't want to mess in that area with the body and knowing what can happen based on all the fur analysis that I've done. The diatomaceous earth, I'm good with that as far as for topical parasites, like with fleas and ticks, because it dehydrates the eggs. Basically, if you put it in the environment or you put it on the body, it just sucks all the moisture out of them. It dehydrates them. So you can eliminate them like that. I've not used it orally. I don't know if anybody here has used it orally in any form. Diatomaceous earth orally?
For maybe GI tract, if it is outside of GI tract, it's not going to work.
Okay, so doctor, you said that if the parasites are inside the GI tract, then the diatomaceous earth could be a good possibility, depending on how it tests. Yeah, that's the whole thing, is that you could guess for a long time. I mean, there's like, look at that list of options of possible products. You could guess a long time and not have the right combination. So you have to have a means of some kind of a biofrequency analysis to know it's the right one. But he said that diatomaceous earth, if it's outside the gut, then it wouldn't work. So, yes?
How far ahead of the game do you think we are when it comes to parasite treatment in the medical profession? I mean, you know, we're getting this in alternative care, but I mean, people just think, you know, parasites, ooh, that's an animal, that's in dogs and cats. I don't have a parasite.
Right. So I think that's why
how long do you think that may take before, I mean, probiotics, we never talked about probiotics in medicine for a long time. Now you see commercials with probiotics. You know, it's like the next best thing that's been around for so long. Do you see the parasitic treatment being accepted in allopathy?
I suspect, just like anything else, if a company sees that there's an option for them to make some money, they're going to create some products. See, they haven't had to because the veterinary market does them such a good job. But if they could see that on the human line that they could make some money out of it, then they'd come up with all these people products, and then it would be in Woman's Day and Ladies' Home Journal and on the TV and telling you people to go rush to ask your doctor about this tablet that the company's going to make this humongous amount of money on. The thing is, the wormers are so cheap. Pyrantel pamoate, I mean, like a bottle that's this big is like 16 bucks. And you could probably treat out of that bottle, you could probably treat, I don't know, 30 people. It's cheap. And so if the companies find that there's an avenue where they can make a whole lot more money, and they certainly could, but it's the very same compounds. Whether you go to your feed store and buy it, they're the same things. You go to a pharmacist, mebendazole, oxybendazole, levamisole, they're the same, whether it's in a human pharmacy or at the feed store. Very same compound, or the veterinarian, same compound. Yes?
Do you find if you find it in your animals, do you look for it in the household family members, or do you just go ahead and treat them for it anyhow without looking?
Well, so I'm a veterinarian. I don't really treat people. So what I'll do is, you know, I got my little ampule that I was using, my parasite ampule where I was testing people. So the people will say, oh, if he's got them, do I have them? And I'll say, well, you want to know? Some people don't really want to know. Do you want to know? So I'll hand them that, and then I'll check, and then yes or no. But a yes doesn't necessarily mean they have the very same thing that the animal does. They could have some other parasite from some other time, and they've just never been tested. So then they would still have to be tested for the right anthelmintic. So, and then you could kind of tell if they picked the same thing as the animal did, then the answer would be yes, they have the same thing. But I really believe that people need to get on the same program as animals. We all need to be dewormed probably, well, at least once a year, if not twice a year, just prophylactically, because they're everywhere, and they're such a problem. What do you think, Dr. Yu? How many times a year should people be dewormed? At least twice a year. And it may not, you don't want to get caught up in just always doing the same thing, because it may not be the same. Right, you can see from this, sky's the limit.
So you do it, and you would do it now, and what other time of year? 6 months from now?
Right, yes. You would get yourself on a schedule, and you might find that you can, if you have the availability to test yourself, then just test yourself. I would test at least quarterly, and you may not have it, and then see again. I mean, it's certainly better to prevent than it is to treat, but like in the case of a tapeworm, you cannot prevent a tapeworm because it has to go through an intermediate host. So if you didn't get exposed to that intermediate host and pick it up, you could take all the praziquantel you wanted, but it wouldn't keep it from happening unless you were really doing it all the time and you caught it at the right phase. And again, if you're an intermediate host, an accidental host, then you don't even know, other than the checking. So a lot of things you can't do prophylactically. Other ones you can, like the groundworms, like we do with the dogs and that. They get the once-a-month heartworm treatment. It also has things in there for roundworms, hookworms, and whipworms. So they get it every month, which is a good thing because they're out there. Yes?
Yeah, I'm just curious. I know AK's been used to sort of look at some of these things as well. There are some different sort of modalities on the internet that suggest that kind of takes the individual's abilities, separates it a little bit from the AK, and kind of makes it more scientific or better for the person who doesn't have maybe experience in that. What would you sort of comment on?
Well, I do believe that, like what I do with the tensor, I've done a lot of energy work myself, and so the person has to be able to blank it out. You have to not have a consideration. If I ever enter in a thought, I mean, I have to just not. You have to be in present time when you're doing that, if you're doing it without a device. So and there are some people that probably because of their state, their condition, at the veterinary conferences the past few years with the Alpha Stim, I've just been aghast at the number of veterinarians, and it's probably that way in a lot of medical professions that are on antidepressants and antipsychotics. And of course that puts you awake, but your brain is in a sleep state, and there's brain mapping that's been shown, and you can get that through Randall with the Alpha Stim info, that you're moving around but you're asleep. So how do you feel about this veterinarian doing surgery on your animal while they're asleep? Their eyes are open and their body's moving, but their brain's asleep. What about the decisions that they're making about the compounds that they're using? They're asleep. It's really scary. I think there should be a disclaimer on the door. Caution, veterinarian on this premises is under the influence. So a person like that would have a tough time doing what I do. So in that situation, I think that and I don't know which ones you're talking about, but if there was something that could give them, so they didn't have to buy a device that maybe was $10,000 or $12,000, but they could find something that was less expensive that would do that, I think that's a whole lot better than guessing. I got tired of going to the cupboard and opening up the doors and going, okay, let's see, what am I going to use on this one this time? Well, let's see, last time we did that, and I just was at a conference and I heard about this, and so, yeah, that's right, and this one didn't work too good, so I'm going to try this one. And so then you package it up and you take it to the client and goes, here's what you need. Now, how could I do that with confidence? So I got tired of that. I had to come up with a way that I had another something that included the individual on the decision. So if there's anything out there that does that, and I think that's cool because a lot of people wouldn't be able to clear themselves out of that equation. Okay, so Dr. Yoon.
Now they do DNA tests is another possibilities. I don't have a full confidence on the DNA test for stool test. And there's another automatic sequencing like a Zyto, etc. They can pick up also different kind of a parasite. How reliable they are, because they cannot tell you there's your active problem while you've been exposed to cerebral resonance you have. I rely on acupuncture meridian assessment, the bioresonance phenomenon as a means to pick up, but there's no perfect way. I know I missed definitely some parasite. I'm still trying to figure out. I'm convinced I have some parasite somehow, somewhere in my body myself. And parasite is like in a relationship, parasitic relationship, the terrain we're talking about. So it might be there, but it might not be a problem for you, but something happened and it will become a problem for you down the road. So, but DNA is one of the things. I'm going to explore those. I'm going to tell all my staff to go through the DNA stool test just to check it out. But I'm not sure how reliable they are because they only tell you it's been exposed to it. Doesn't mean it's biologically active problem.
I just wanted to share that Ron Williams had worked with me, and he, at my request, made an inexpensive Radio Shack parts, and he calls it a Biotron, and I used it on my horse. And my horse was always getting problems with the ulcers, and it showed me that my horse needed cabbage, and it would totally balance it and change my horse's life. So we don't give my horse carrots because of the Biotron testing. And they think they're now $1,200, but that simple device gave me the confidence that it was worth the trouble, and I have a much healthier horse because I believed in the Biotron, and I saw what it was doing to balance the horse.
So people can get the Biotron then, that's, if they Google that or something, they could find that.
They're at the booth next to me.
Oh, I see. Okay, so they have something that's not too expensive.
Her name is Josette.
Josette. Good. Yes.
Do you have any cooking temperature recommendations for eating infected meat?
Oh, let's see here. Obviously not on the tip of my tongue. Well, so it can't be raw. So that takes out rare, medium rare. So you're going to have to be somewhere between medium or well done. So I guess it's how you like your shoe.
Well, you can have a raw steak or raw pork. Just make sure you take Jack Daniel with it. You know.
My cats don't do well with chicken, so I do the raw rabbit and then a lot of fish.
That's good. Yeah, I try to feed cats things that they would eat in the real world.
The raw rabbit pellets, now I'm thinking, well, those companies they don't know what the rabbit meat has in it. So
Well, they're going to raise rabbits that are in a rabbitry. They're going to come. Those rabbits are going to come from some place where they only lived to be 5 months old, and they never were on the ground, and they would be parasite free, and there's probably 10,000 of them in a building. Yeah. So because their lifespan is so short, only 5 months before they're at slaughter, you don't have as much time to get any chronic anything. So rabbits are really pretty safe, but in regards to your cats, try to get them to eat canned food, not dry. The more the canned food they eat, the better be. Okay, that's good. Yeah, rabbit though is totally good and more and safe. So, alrighty. Well, thank you all. This has been a whole lot of fun.